calves and abdomen. Again, let's look at a child. Cheeks, thighs, abdomen, and stomach area. It is more difficult to bruise an area of the body where there are large masses of soft tissue. Bruises in these areas are more likely to be abuse-related. In addition to the location of the injury, the shape of the injury can be a clue to what was used to inflict the injury, thus identifying abuse-related injuries. For example, if a child has been struck with force with an extension cord, belt, board, hand or fingers, a distinct mark or impression will be left. Here are examples of real child abuse situations. Remember, the age and development of the child is very important in assessing whether the injury is accidental or abuse-related. For example, if a 3-month-old child comes into your care with bruises on his face and mouth, it is highly unlikely these are accidental injuries. Let's talk about behaviors and characteristics of children which might indicate abuse or neglect. Extremely fearful behavior. For example, if a child ducks when you move your hands around them, they may be fearful of being harmed. Extremely aggressive, demanding, or rageful behavior. Some abused children display these behaviors as they are starved for attention and desperately seeking it. They also may be imitating the behavior of their parents. Overly compliant or passive behavior. These children may allow other children to take things away from them or go along with whatever is suggested. This may be a result of trying to avoid a violent assault. Extremely dependent behavior. These children may cling to staff and have difficulty separating from them. Keep in mind the age and development of the children to determine normal dependent behavior. Role reversal behavior. Watch for children who assume the role of parent of the other children. They may also comfort and nurture the other children. Extreme lags in development. These may be the result of emotional deprivation or nutritional neglect. Indiscriminately friendly behavior. Many abused children are so hungry for affection they are inappropriately friendly with strangers and playmates. Multiple explanation of injuries. If a child offers more than one explanation of what did or didn't happen to cause the injury, this could be a clue that the injury is abuse-related. It is important to note that behavior and characteristics alone are not necessarily an indicator of abuse or neglect in a child. You must look at the whole picture. What are reporting requirements in Oklahoma? Healthcare professionals, teachers, and anyone who has reason to believe that a child has been abused is required to report the matter promptly to Child Welfare in their local Department of Human Services county office or to the statewide child abuse hotline by calling 1-800-522-3511. Yes, this does include the owners, operators, and staff of all child care centers and homes. It is important to remember you do not have to know all the facts. You do not have to have all of the answers. If you suspect child abuse or neglect, you have to report the incident to child welfare. Let child welfare do the investigation and make the decisions. Failure to report suspected child abuse or neglect in Oklahoma can result in criminal charges being filed against you. It is natural for you to be concerned about your obligation to report. It is likely you will have questions about what you have seen and heard. Do not hesitate to contact Child Welfare Services or daycare licensing for guidance. What is the definition of child abuse? In Oklahoma, it is defined as harm or threatened harm to a child's health or welfare by a person responsible for the child's health or welfare. Harm or threatened harm may occur through non-accidental physical or mental injury, sexual abuse, or neglect. A child means a person under 18 years of age. Physical abuse is non-accidental injury to a child. Physical injury means temporary or permanent damage or impairment to the body. Mental injury means an injury to the child's intellectual or psychological capacity. It is the result of a pattern of cruel acts or statements made to the child or in the child's environment. This could include a child who is exposed to domestic violence. Sexual abuse includes rape, incest, lewd or indecent acts or proposals, and sexual exploitation. Neglect is indicated when the parent or person responsible for the child fails to act in a prudent or responsible manner to provide for the health and general welfare of the child. Long-term neglect could cause serious harm to a child. Examples would include inadequate clothing, food, shelter, medical care, or supervision appropriate to the child's age or development. Please remember, child welfare is here to assist you with difficult situations. It is vital that you remember that as caregivers of children, you are an important link in providing for the health and safety of the children for whom you provide care.
The safety and protection of children is everyone's legal obligation. So remember, when you suspect child abuse or neglect, it's your duty to report it. Our next topic is sudden infant death syndrome, otherwise referred to as SIDS. This topic can cause anxious feelings among child care providers and parents alike. There are numerous practices that can greatly reduce the chances of a sudden infant death. Pat Dameron, the past SIDS program coordinator at the Oklahoma State Department of Health, helped us understand what SIDS is and ways to reduce the chance of sudden infant death syndrome.
You're with the Oklahoma State Department of Health. What's your position there?
Yes, I'm the coordinator of the SIDS program, and our program provides support and education for any kind of SIDS issues that may occur in the state of Oklahoma.
Well, what is SIDS?
Well, SIDS stands for Sudden Infant Death Syndrome. The definition of SIDS is the unexplained and sudden death of an infant under the age of 1 year.
Well, what do we know about the victims of SIDS?
Well, there are some things that we do know. We know that generally infants die between the ages of 2 and 4 months. That's when we see the peak of deaths. And then after 6 months it begins to go down and decline. But we can still have a definition of SIDS deaths up to 1 year. The other thing that we know is that these are generally healthy babies, that these are full-term babies. So sometimes people think that these are sickly babies, but they're not generally. The other thing that we know is that these babies, generally we see a higher rate of boys dying of SIDS than girls. We also see a higher rate of SIDS in the winter months. Now, we can't predict SIDS and we can't prevent SIDS. We don't know what causes SIDS, so we don't have the ability